Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Peterson.
Hello, Dr. Reynolds. Thank you for seeing us.
Of course. Now, I understand your son, Jake, has been having some difficulties with swallowing. Can you tell me more about what you've observed?
Yes, Jake seems to struggle, especially when eating solid foods. He often coughs or chokes, and it takes him much longer to finish meals compared to other kids his age.
I see. And for how long have you been noticing these symptoms?
It's been going on for about 6 months, but it seems to be getting worse.
And has Jake mentioned any pain or discomfort while swallowing?
He says it feels like the food gets stuck sometimes, especially around the middle of his chest.
Thank you for the details. Has there been any significant weight loss or changes in appetite?
Not really a weight loss, but he's definitely been eating less. I think he's scared of choking.
Understandably so. Dysphagia, which is the medical term for difficulties, can have various causes. We'll need to run some tests to get to the bottom of it. Has Jake had any history of throat infections or surgeries?
He had tonsillitis about a year ago, but no surgeries.
All right. It's also important for me to know if there's any family history of neurological or muscular disorders.
Not that I'm aware of, Doctor.
Thank you. I'll make a note of that. Now, based on what you've described, we may need to conduct a swallow study, which will give us a clearer picture of what's happening when Jake swallows.
What does that involve?
It's a non-invasive procedure where Jake will swallow a special liquid and will use X-ray imaging to watch how it moves through his esophagus. It can help identify any physical or functional issues.
Will it be painful for him?
No, not at all. He might find the taste of the liquid a bit unusual, but there's no pain involved, and the test is quite quick.
That's good to know. I just want to understand what's causing this and how we can help Jake.
Absolutely, and that's our goal as well. In addition to the swallow study, I'd also like to refer Jake to a speech therapist who specializes in pediatric swallowing disorders. They can offer valuable insights and techniques to help him swallow more safely and comfortably.
That sounds like a great idea. Anything that can help him.
We'll work closely together to ensure Jake gets the best care. After the tests, we'll discuss the results and any necessary treatments or interventions. Remember, early intervention often leads to the best outcomes.
Thank you, Dr. Reynolds. It's comforting to know that we're taking the right steps.
We're here to help. Let's get Jake scheduled for the swallow study and I'll also provide you with the contact details for the speech therapist. We'll get through this together.
Thank you so much. We really appreciate your support.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. Mrs. Your optometrist has referred you to me due to some concerns regarding your eyes. Keratitis, I believe?
Yes, that's correct. I have been experiencing some discomfort and redness in my eyes. My optometrist said it might be keratitis.
All right. I do have the notes from your optometrist, but if you don't mind, could you describe the symptoms and when you first noticed them?
It started about 3 months ago. I initially thought it was just eye strain because I've been working longer hours on my computer. My eyes felt itchy and sensitive to light. Then, about a month ago, the redness started. My vision got a bit blurry, and there was this constant gritty feeling as if there's sand in my eyes. It's been quite distressing.
That sounds uncomfortable. Have you been using any over-the-counter remedies or eye drops?
I tried some lubricating eye drops at first, thinking it was just dry eyes, but it didn't really help. Then I got an antibiotic drop from the pharmacy, but it only gave temporary relief.
Do you wear contact lenses or have you had any recent eye injuries?
Yes, I wear contact lenses. I've been wearing them for about 10 years now. I haven't had any injuries, but I might have slept with my contacts in a few times accidentally.
That's an important detail. Improper contact lens care can certainly be a risk factor for keratitis. Now, how about any prior eye surgeries or infections?
No, nothing like that. This is the first time I've had such an issue.
I understand. And how about your general health? Any other health conditions or medications you're on?
I'm generally healthy. I do take antihypertensives for my blood pressure, but that's about it. I'm not diabetic or anything.
Good to know. And has anyone in your family had similar eye issues?
Not that I'm aware of. My family mainly has glasses, but no major eye diseases.
All right. Based on what you've told me, we will need to conduct a few tests to determine the cause and extent of the keratitis. We'll look at the type of inflammation and if any microorganisms are involved. Your contact lens use might be a contributing factor, so we might discuss proper lens care and potentially take a break from wearing them for a while.
I see. I'm really hoping for some relief and a solution. This has been affecting my daily life quite a bit.
I understand your concerns, and we'll do our best to get to the bottom of this. Depending on our findings, there are various treatments available, including specific eye drops or medications. We'll ensure you get the appropriate treatment.
Thank you, doctor. I just want to get back to normal, and I'll follow whatever recommendations you have.